We've all felt lonely, right? Of course. It kind of feels like part of being human. But what if I told you that feeling was actually a serious public health threat? That's what we're diving into today. Loneliness isn't just a mood, it's become a crisis that's impacting millions of people in ways that are, frankly, pretty shocking. And to kick things off, I want to share a fact that just might change the way you think about being alone.
Okay, get ready for this, because it is a big one. Major health studies have found that being chronically lonely is as dangerous to your health as smoking 10 to 15 cigarettes every single day. And no, that's not me exaggerating for effect. That is a direct scientific comparison based on some really serious research. It's a wake-up call, for sure.
So, with evidence this powerful, it's no surprise that the big global health organizations, like the World Health Organization, have completely changed how they see this. Loneliness isn't just a personal feeling anymore. Nope. They now classify it as a major risk factor for your long-term health. It's right up there with obesity and not getting enough exercise. The takeaway here, this isn't just your problem or my problem. It's a collective issue that needs a serious collective response.
All right, so to really get why it's being called a crisis, we've got to look at the numbers. Just how widespread is this thing? How many people are we really talking about here?
Check this out. A huge Gallup World Poll from 2023 found that nearly 1 in every 4 adults on the planet said they feel very or fairly lonely. 23%. That is a staggering number. I mean, just think about it. If you're in a room with 3 other people, the odds are pretty high that at least one of you is feeling this way. It's everywhere.
But here's where it gets really interesting. This feeling, it isn't spread out evenly. And our stereotypes about who's the loneliest, they're usually way off. We tend to picture an elderly person, maybe living by themselves, right? And while that's definitely part of it, the data paints a much more surprising picture.
So let's really dig in and see who feels lonely. When you break it down by age, the results are, well, they're not what you'd expect at all.
What researchers have found is this kind of U-shaped curve when it comes to loneliness. The two groups with the absolute highest rates are at opposite ends of the spectrum. Young people, we're talking ages 13 to 29, and the very elderly, people over 80. For young adults, it's often about the crazy social pressure and just figuring out who you are. For older folks, it's more about things like losing a spouse or not being able to get around as easily. Two very different reasons, but the same powerful feeling.
Okay, so we know it's a huge problem, and we know who it affects most. But what's the actual damage? What does loneliness physically do to our bodies? This next part, this is where the public health crisis part really hits home. The toll it takes on your body is hidden, but it is severe.
Let's break down the 4 biggest health risks. Number 1, a much higher chance of dying early. Seriously, studies show that having weak social connections can slash your chances of survival by 30 to 50%. That's huge. Number 2, cardiovascular disease. We're talking heart attacks and strokes. Number 3 is severe mental health problems, things like depression, anxiety, and even a higher risk of suicide. And finally, number 4, it can actually speed up cognitive decline and increase your risk for dementia. It's a full-body assault.
And just to really hammer this point home, let's put it in perspective one more time. The risk of dying from loneliness, it's not just like smoking. We have major sources, even the US Surgeon General, saying it can be more dangerous than some of the things we hear about all the time, like obesity or not exercising. It is absolutely a silent threat, but its consequences are incredibly loud.
Oh, and the list doesn't stop there, not by a long shot. Chronic loneliness is also tied to a weaker immune system, chronic inflammation all over your body, terrible sleep, higher rates of substance use, and even things like putting off going to the doctor because you don't have anyone pushing you or helping you get there. You can see how each of these things feeds into the next, creating this awful, vicious cycle.
So after all that doom and gloom, it would be really easy to just feel hopeless, right? But this is where the whole story pivots. We're not just here to talk about the problem. We're talking about pathways to connection. Because the science doesn't just point out the dangers, it also shows us the way out. And here's the best part, the really good news. Loneliness is treatable, 100%. You can think of it like any other health issue. There are proven, tested strategies that actually work to help people rebuild those connections and even reverse the damage. This is not some life sentence you just have to accept. So what works? Well, research shows a few things are super effective. Getting involved in group activities, like volunteering or maybe joining a club, that's a big one. There's also a cool psychological trick we'll get to in a second.
But look at what's right at the top of that list: actively contacting family and friends. It sounds simple, but studies show again and again that it's one of the most powerful and direct things you can possibly do.
So, what is this cognitive reframing thing I mentioned? Basically, it's about rewiring your brain. When someone is chronically lonely, their brain can start to see rejection everywhere, even when it's not there. They might interpret a neutral look from a stranger as something negative. This technique helps you catch those automatic negative thoughts and challenge them. It's a proven way to break that isolating cycle.
All right, so we've looked at the scale of the problem, the scary health risks, and the real proven solutions. So why not call now? It all boils down to one final, incredibly simple, and super direct takeaway.
When you think about everything we've talked about, what's the single most direct and effective first step? What's the one thing you can do, not just for you, but for the people you care about?
It really does come back to the simplest thing. That one call, that one text message. It does so much more than just make someone's day. It's a real, concrete action against this massive public health crisis. You're literally helping to build immunity, strengthen hearts, and sharpen minds. So really, what are you waiting for?